how do we normalize mental health care within our society and community today?
So before we talk about normalizing it, I want to address stigma in general, and where it comes from and why we have it, and just look at those pieces. So someone in the film talked about it very briefly, right? And stigma comes from a time of mistrust for healthcare systems, healthcare providers, systems in general, which actually serve as a protective factor in some situations, right? So if we look at culturally, racial bias, racism, discrimination, a lot of the generations of past still have that mistrust of healthcare providers, mental health services, which was a protective factor in a lot of ways, right? So we guard ourselves against being harmed by people that may want to harm us in the past, right? But now, as we move forward, some of the things that we hold on to protect ourselves can work to our detriment. And so that's what we want to work together as a community to figure out ways to minimize that stigma. A lot of times it comes from pride. A lot of times it comes from culture. A lot of times it comes from that mistrust. Even thinking about my own experience, I'm a therapist, but I didn't get therapy until I was an adult, right? So, and I had a lot of things I should have as a child sought therapy for. And even going into the field of mental health, my family was giving me a hard time. Like, are your clients, do they go to church? Like, what are you doing? What do you mean? Right? There's very, very heavy stigma and misunderstanding around mental health services that I even experienced as a mental health provider from my family still. Like, what is it? What are you doing? What does that mean? So really looking at those pieces is huge as far as stigma is concerned. The other piece is what I notice is a lot of people do not know what they don't know about mental health. So when we look at, and my work is really based in trauma, so when we look at multi-generational trauma, intergenerational trauma, chronic, stress, complex trauma, a lot of times grandma went through it, mama went through it, I'm going through it. They don't know there's a different way. So a lot of times you come to them and say you need counseling, and they're confused about why you think they need counseling because nobody else got counseling. Grandma got up and went to work and she moved on, right? So a lot of times we are in survival mode, which again is a protective factor, but it's working to our detriment when we don't seek services and get help. So a lot of the work that we can do to minimize that stigma and work with that is have these conversations, have mental health professionals go out into the community. I get out of my office as much as I can. I always say a lot of work can be done individually, but so much more work can be done when I go out and provide psychoeducation to the community. Because again, a lot of people, when I say, hey, have you experienced trauma in an intake? They say no. When I start asking very specific questions and I define trauma, they answer yes to a lot of those things, right? A lot of people just don't know that they need the services. And then once you go in and explain that and educate them, it's not that people don't want to seek help for themselves or for their kids, they just don't know. And so educating communities of color in particular about confidentiality so that they understand that what you tell me here, there's a few reasons that I might have to get people involved, and explaining that from their perspective where they understand that anything that I have to disclose is for your protection and your safety, right? And so I'm not working against you if I have to share something. It's that I'm working with you to get you the education and the resources that you need. And so I think a lot of times that can help. And also because I've had my own personal experiences with experiencing trauma and having communities stigmatize, those things and say, don't go out there and tell anybody our business. I can speak from that perspective to my clients and to the community of saying, I get it. I still get backlash about being in the field, so I understand it. But I think we have to have these conversations, and there has to be education about the services.
Thank you so much for sharing that. Dr. Sharon, what are the signs that you could be dealing with a mental health disorder?
Can you hear me? I'm good. Okay. That's a mental health disorder. That's a very weighted. Those are very weighted words. They're very heavy. I want to just kind of focus on the word disorder, because when you start to see your life is in disorder and your normal coping skills are no longer working for you, that's when it's time to get help. And having feelings of depression and having feelings of anxiety, that's a normal thing. I have that. But we develop coping skills around it. So I might exercise, I might meditate, which are healthy coping skills. I might watch TV all night long. That's not so healthy, that's a distraction. My husband may play video games if he's feeling signs of depression. There's some of us that might do some more unhealthy coping skills like smoking pot or something, well, you know, if that might be healthy or unhealthy, depending on who you ask. But the question is there one day when you're feeling so sad and having so much anxiety where you can't get out of bed and those coping skills you developed are no longer working? And you're in the grocery store one day and you notice yourself having a panic attack and you can't avoid it and you can't move on from it. Those are the moments where it is time to reach out. And we've all been there. Some of us will keep going. We will say that we can work through it. Just like you said in the family, we will do all we can to keep it moving. That's what we've been taught. That's what I've been taught. And similar to you, I didn't go to therapy until I had to. Like, it was a requirement for me to get my degree. And that's the only thing that got me in the office because my business was my business. And it wasn't until I experienced that I realized how important it was.
That's so important, especially with both of you. It was interesting as you went into therapy later in your adult age and then got into a career, and you as well later on. You probably dive into that due to your career and to learn more about it. But how was that experience for you? What besides having to kind of go to counseling, what were some things that you really pulled away from counseling and therapy?
Yeah, I think one of the important things that I want to say that you don't want to wait until you get to the point where you can't get out of bed and you're having those panic attacks. You actually want to be able to talk to someone to get healthy coping skills. Now, it was very difficult for me. I had to go through a few therapists because I was picky, and quite frankly, I thought I was good. So you had to be really good to work with me. And so I went through quite a few because that first person you go see may not be the best fit for you. We are all different therapists, and we all have our different styles of working with people, and you're going to connect to someone who's aligned with you. So just because it may not work the first time, keep looking. There is someone out there for you that will work with you where you're at, and I think that's extremely important.
Right, thank you for that. Next question. By the way, we're going to open up for conversation discussions. I want to kind of just get everyone kind of go through a few questions, so hold on to your questions till just for a few minutes. Dr. Watis, what are the chronological steps in seeking help when you are struggling with anxiety, depression, PTSD, or other mental health challenges?
So I'll try my best to go through this quickly. I would say start with like recognition. So recognizing what is going on inside of you. So we got this manual that tells us all the diagnoses for mental health. But the last point of each one of those says, do all these symptoms affect your functioning? Does it affect you at work, in your relationships, and educationally? And I think that's a good data point for all of us to say, well, sometimes I have worries and sometimes I have concerns, but do I have worries so much so that I won't speak in public? Or am I so sad that I won't get out of bed or have this relationship? Am I so fearful that I won't drive down this road anymore? That's that point when we start to go, wow, maybe there's something going on in me that's affecting my ability to have a satisfying life. And I think that's the first data point, is just recognizing that that's there. And kind of along your same point, just because we have worries and we're scared and we're fearful, those are all normal, natural emotions we're supposed to have. I think when we try our hardest to get rid of them and when they become debilitating, we no longer do the things we want to do in our life. That's the first point. So I think recognizing that maybe there's something going on where I'm not being able to live the life I want to lead. And I think that goes to the second point, which is, I think, is community. I'm a systems person, so it's all about community. Is reaching out to somebody who you trust. The key word is trust. I underline trust. A trusted friend or a family member say, have you noticed something different about me? Since this event happened, have I been acting differently? Am I missing out on certain things that you wish I would do? Is there an interview I've always wanted, or a place I've always wanted to go that I don't want to go, and I always make up excuses for it? That's a good data point for somebody to reach back and go, you know what? You never really go out with us on Fridays. You always just go home and drink wine or smoke weed. if that's right. And that starts to tell you that somebody else is noticing something going on in me. And I say trust because it's not just the homeboy down the street. It's really somebody you can trust. And then after that, I think the other thing, if we're going in chronological order, is connecting with a therapist. And we are internet people, which is fine. But there are search engines like you would find apartments where you can find therapists. And you can search and find a therapist in your community that only works with depression or specializes in families. And you can look for somebody that matches your specific need. And there are evidence-based treatments. And evidence-based means they have been researched with a specific population, and that techniques are known to work. For every single disorder, for anxiety, there's cognitive behavioral therapy for anxiety. There's acceptance and commitment therapy for depression. There's prolonged exposure for PTSD. I mean, there's a bunch of stuff out there. And all these search engines, you can look for that and say, does this therapist do that? Oh, I'll try it out for a little bit. And so I think that's, if we're looking at the order, it's some insight in ourselves. That, something's different about me. I'm not reaching that potential I want to be. And I'm getting a data point from somebody else to say, yeah, that's true. There's some things I wish you could do in your life, but you're not quite doing it. And then actually reaching out and getting help. And I mean, there's 5 or 6 of us here who could point you in the right direction of a great therapist in the area. So I think that's just a good way to tackle it.
Yeah, thank you so much for sharing that. Yeah, I think the key word is, identify. Sometimes you don't know when you're dealing with what you're dealing with. And keyword was trust. Identifying people in your life that you can trust, and you can just kind of get their own view of kind of what they see in your life, so thank you for sharing that. I think that's huge. Next question that we have, Mr. Rodriguez, how can we inform policy for mental health reform surrounding minority communities? You definitely have a strong sense of research and understanding with black males, in communities, and you're doing heavy research on that. Maybe actually unpack a little bit about that and then kind of dive into this question as well.
Can you all hear me? No. Can you hear me? Hear me now? Okay, so my research specifically looks at black manhood and black masculinity. And that's because I believe that as a black man, it's our perception of what it means to be a man and how we enact that in response to systemic oppression that leads to these trends associated with black males. So if we can change our perceptions of what it means to be a man, then we position ourselves to respond differently to some of the things that we are subjected to within society. And so when you talk about policy, one of the biggest things is communicating, sharing what we're dealing with, because in those conversations, then we can actually start to try to figure out what is impacting us directly or indirectly. As a researcher, I'll speak specifically on my research. Within society, in the simplest terms, to be a man, you must be able to provide, protect, and procreate. Well, we know that in order to provide, that means you have to get a job. But how can you get a job if you're not being adequately educated? And so if you can't get a job because you haven't been provided the adequate education, or for whatever reason, adequate education lagged off at some point in time, that increases the likelihood that you're going to resort to alternatives. In our society, we label illegal, right? And so what we have to really, we can't pinpoint what is impacting these things. A lot of times the conversation is focused on black males are incarcerated, black males are dying at this age, but we're not necessarily having this conversation to say what factors are contributing to that. So if we're talking about that, then we can start to have the conversation and say, well, what led you here? And so I just gave you a connection between the state of black males within our country and education. So ultimately what researchers like myself can then do is say, well, what is happening within the schools? We know that black boys are not being educated, but we actually need to start to say what is going on with the policies, not just the way in which policies are written, but also the way in which they're interpreted, right? Because you can have the exact same policy in a school district, but it may be interpreted differently by different individuals, or it may be interpreted differently and applied differently based on the students in that particular school. So I'll give you a prime example when we talk about black male mental health. And I'm not exactly sure if it's the same now, but we know back in the day, imagine as a black male, you have a family, and you can't get a job, which means you're struggling to provide for your family. And so your family actually has access to Section 8 housing. But in order to take advantage of Section 8, that means that there cannot be a male within that household, right? So as a man, that means you have to make a choice between, do I stay in my household and physically be here even though I can't provide what my family needs, or do I remove myself because in removing myself, I'm giving them access to something that I cannot give them? And so let's just talk about the mental strain that will have. What happens if you remove yourself and now you're being subjected to the stereotypes that says, oh, you're just another black man who doesn't want to be a part of your family? Now we're also talking about Section 8, so we're talking about a particular class. So in that particular community, I just removed myself from this household that I want to be in, but systemically I am not able to be what I feel like I should be. So then I'm more likely to adhere to certain coping mechanisms. Well, we know within our communities what's more readily available. On every street there's a liquor store, right? We know that malt liquor has a significantly more alcohol concentration. It's sold at a lower, it's sold more cheaper. And so these are the things in which we can actually say it's these policies that are having a direct correlation with the current state of us. But if we aren't having these conversations to talk about, hey, this is what I'm feeling, and then starting to identify the sources of those feelings and those emotions, then we're really hindering our ability to say, how do we address the systemic change, specifically the policies that are directly impacting our lives?
Thank you. Thank you for sharing that. Ms. Evers, if you have a friend who is going through a lot mentally and emotionally, how do you gently encourage that person to seek professional help, counseling, without making her or him feel like they are a project to be worked on?
I don't think that there's a very delicate way to do that. If this is a friend and this is someone who's very close to you, you have to have harder conversations sometimes with that person. This can be a conversation that is a friendship killer, that you see that this person is struggling and they continue to struggle. You know what's going on, and I, as a therapist, in some instances, have had friends that I see this struggle happening. You can speak to it. You can be there for them. You can be that supportive listener, but you're still a friend. You are emotionally involved with that person, and that's a different relationship than something that they would find with a counselor. So really just putting it out there, letting them know what you see, what their problem, well, you can't even say, you don't want to know what your problem is. You can't really start it like that. You don't want to do that. But really very gently saying, these are the things that I'm seeing. I don't know if you're seeing these too. If you are seeing these things and it's a problem for you, then let's work together to find a solution. One of the solutions can be possibly speaking to someone outside of your support circle, outside of your family, who's going to be emotionally involved with you and invested with you, and will speak to you from that emotional involvement and investment. So moving out to someone who is in a non-judgmental place to talk to you from a different perspective than you might have considered is sometimes a life-changing thing. So.
No, that's so true. Some of my deepest relationships with people that I have in my life are people that didn't just talk at me, but walked with me. And I think there's a big difference in how you say it, how you approach. And I was actually telling somebody this week, I was like, one of the best things you can do as far as being a light sometimes in people's life is sitting with them in the dark. So as long as people know that you're for them, you are with them, and you are wanting to walk alongside them for the betterment of life in general. And I think there is a good sentiment within that, and at least in approaching healing. So I definitely do relate with that and love it. So yeah, thank you for sharing that. How do we conceptualize our mental health when engaging in social media? Are you even a social media person? Would you consider yourself?
I'm on, right? Oh yeah, I am. Okay, I would. It's a love-hate relationship. So, one of the things that was said in the film is that the internet's kind of the best and the worst thing that's ever happened. At the end of the day, I think it's all about connection, and research shows that unless you're face-to-face, sharing space, sharing air, mirroring nervous systems with another human, you're not meeting your need for connection. So, even FaceTime, things like that, text messages, connecting across social media, it's an initial connection, but it's not gonna meet the need like somatically in your body that you need to not feel alone. So, I think it's all about authenticity at the end of the day. We don't see a lot, and we're seeing more, but we don't see a ton of authenticity in social media. So I think that's a big part of it. Not glamorizing anything, but also not necessarily hiding. At the same time, you know, your struggle can be your own. You know, a lot of times people don't share things they've gone through until they're on the other side of them. So there's also this idea of walking through your journey and then sharing your reflection of your experience with people. Sometimes it's too raw, and you're exposing yourself for it's too much. And I guess to add to that specifically for why we're here tonight is representation. You know, I'm a therapist. I'm in therapy. I tell the freaking clerk at the grocery store, I'm like, well, where are you going today? I'm like, going to see my therapist. Just normalizing it. You know, I can guarantee the majority of therapists are in therapy or have been at some point in time. I also didn't start therapy until adulthood, and it was because of the graduate program that I was in. And I didn't think I needed it. I was just here to help everybody else. I think anybody can benefit from it. And to echo, I believe what you said, don't wait till you're in crisis. Crisis is one of the harder times to really make progress because you're stuck in survival mode. Go when things are kind of going well and you have the time and the space to put things into a regular practice so that you can avoid the crisis.
Thank you. Thank you for that. So I want to honor everyone's time and open the floor for questions. Yes, we're at 8:20, so I want to give about 15 minutes for everyone to kind of share a little bit of their thoughts, whether it's something from the film or something that's kind of been presented around this table.
Just a follow-up question with you. What would you do with this Section 8 housing crisis? Like, to me, everything else, I can see how communicating will work, but if you got to choose between your family and a job, I don't think going to for me, I don't think going to a therapist would really help the situation.
I think one, we can't approach therapy as the end-all be-all. It's a part of working towards kind of becoming whole. So I think at some point it's working within, but also recognizing there are some things that are outside of your control. And I think that's the critical piece. You know, everyone up here probably could speak to it, that within our fields, we all may look at the same topic, but we only look at it through our lens, and rarely are we in conversation with the other. And it's strategic that way, because if your psychologists are in conversation with your sociologists that are in conversation with your political side majors and so on and so forth, then everyone starts to actually look at the entire pie and start to come up with change. But as long as we don't get in conversation with one another, then it's really just people taking shots in the dark and hoping that their contribution is actually going to foster change. And so I think part of us having that conversation within our community is then allowing us to say these things are impacting what's happening in here outside. We talk about it within our community and say, hey, we're subjected to systemic racism and institutional discrimination and so on and so forth. But when you're able to quantify or to actually say what it is that you're experiencing, then it allows us to be a little bit more concentrated in our efforts to change those things directly.
And so I would say the way a therapist could help you is, a lot of times a therapist's job is not to solve your problem. Our job is to help you figure out what is within, what do you truly want, what is your value, right? And help you be okay with what you maybe can't have and making decisions you can live with. So sometimes we're just there to bounce off thoughts and to help you get out of your own head. It's very hard to get out of our own thinking. As our thoughts come into our mind, they are all very real and very powerful. They all seem super important, but when you can get them out on paper, get them out to somebody who has no stake in it, you know, whether you live with your family or don't live with family, I personally have no stake in it. I would go home to a different setting, but I can look at your situation and help you just think through, maybe ask you some questions you never thought. That way, when you make a decision, whether it's the best one for you or the worst one for you, you have a course, you have a direction at least you're comfortable with. That's really what our job is. It's not to say, well, I think you should live in Section 8 house. You can't leave your family. I mean, that's my personal opinion on yours. It's not my job. My job is to help you come to a conclusion that you're okay with, that you can move forward with. Does that make sense?
We hold the flashlight on the path that you're on. That's what we do. We're not telling you to go one way or another. That's just our jobs.
And so just to kind of let you all know, there's not really any literature that makes that connection between Section 8 and the mental health of males or women or in general. because that conversation isn't taking place. That's something that I just happened to realize. I'm growing up in Chicago and having conversations with my family and friends and starting to realize how, certain households were Section 8 households, and because of that, fathers didn't choose to walk away, they were forced out, right? And then when you said, well, my dad was a heroin addict or my dad was an alcoholic, and it made me start to think, well, was he like that before he left? And if not, then did this directly impact his coping mechanism, right?
Love this sweatshirt, by the way.
Thank you.
Are you a Bomani Jones fan by chance?
Of course, that's where I got it from.
That's where I got it. I have a question for you. You were talking about trauma. I'm sorry, I didn't catch your name. In the middle. Yes, sir.
Yes, okay.
All right. You were talking about trauma, and you said it all begins by defining trauma. Would you define trauma?
That's a tough one. It's somewhat individualistic. So it's anything that rocks you to your core that you were unprepared for. So for some, a car accident could be a traumatic event. Some, it could be falling down the stairs. I mean, it's really, I would never tell somebody, well, that's not traumatic. It's really how it rocks your core and what you've known, right? So something out of the ordinary. So car accident, who's been in a car accident? Okay, when you first got your license, you were how old? Just yell it out. Got it, okay.
16.
So when you got your license, you got insurance, right? Did you know that people got into car accidents? Did you see people get into car accidents? Did you ever believe you would actually get into a car accident? No, I say everybody says, no, not me, I'm not that guy. When you got into your first car accident, what was your reaction? Oh my gosh, right? That essentially is traumatic, even though in your mind, in your core, you're like, oh, this would never happen to me. Boom, all of a sudden happens, it rocks your core belief about who you are, what you can do, and what you're capable of. It just changes your whole world. So to me, that's a trauma, is when your core belief is rocked. And so you can just look through events that happen in your world, in our community, in your life, and how these events can start to create these traumatic data points. Does that answer your question?
Can I add to that? Oh, I'm on. Okay. I'm glad I'm not talking to myself. I think also, what we learn about in our schooling is this difference between big T and little t trauma. And so trauma can also be just this ongoing state of things. Having an emotionally abusive parent, that is traumatic. Institutional oppression, that is traumatic. There's also secondary trauma too. And so it can also be things that don't even happen directly to you that can shake you. And it can also be things that are so ongoing that you don't even realize, kind of speaking to what you were saying, is that a lot of times we don't realize that we're carrying a lot of trauma. And I do a fair amount of body work in my practice, and we carry all of that trauma in our bodies. We've got aches, we've got pains, we've got illnesses and ailments that we can't quite explain. Our body carries everything that's ever happened to us, and we also carry, as people of color, we carry intergenerational trauma too. And so it's kind of everywhere, and I don't mean to say that in as a downer, but in a way to just validate that it doesn't always have to be a big thing that happens. Life transitions, even the good ones, can be traumatic because change is hard. And so, a lot of times I think we don't give ourselves even the permission to label something as trauma, but that it's very fluid in what it can look like.
I just want to say I appreciate you saying that, because I was thinking in my head recently through conversations with my own counselor and conversations with my friends, because I'm the one who went to counseling, and everyone was like, no, don't go to counseling. And so then when I go to counseling, they say, so what you learn in counseling? Because they don't want to go, and so they use me to talk about, and so more and more of them starting to go on their own. But what we started to realize is, because we had trauma-filled childhoods, that we actually started seeking that trauma out in our adulthood. Or there would be things where it was like, oh, I'm at peace right now. Something's not right. I need to go find something, and not realizing what we were subconsciously seeking was the trauma, because we knew that's what we knew, and we operated, it was our norm to operate within that trauma, right?
You can get used to a certain level of chaos in your life, and then even if it's a completely different kind of chaos, you know that it's noise, and you come to crave that noise.
You mentioned there's silos a lot of times, and so we need to break those silos, because a lot of people who experience trauma present to medical doctors, right? So they present in a doctor's office, and they have headaches, they have migraines, they have stomach aches, they are nauseous. These different things are happening, and there's no medical reason for them. It's because they have some chronic stress or something that's going on with them. And I just want to say that poverty is traumatic. So as we're talking about those things, a lot of the communities of color, just because of systems, not all black people grow up in poverty, but a lot of black people grow up in poverty because of the systems that are in place. I grew up in poverty, and a lot of my trauma came from poverty, came from that intergenerational lapping up. Colloquially, I call it lapping up, when you live with grandma, uncle, mama, mama's man, whoever else is in the house, and all of those adults that have not healed their trauma impact you as a child. So that's that secondary trauma that you experience. So if mom and grandma experience sexual abuse, or they experience something else and you haven't, you are living through their worldview, because they're teaching you your values. And so those things, those chronic and complex crises that you may be in, live in your body, and it's hard to get away from them without proper healing.
Awesome, thank you.
Hi, I have kind of a different question, so and anyone can speak to this. I grew up without insurance. I think a lot of people did, especially in poverty-stricken communities. I think my dad to this day still doesn't have insurance. Me and my mom didn't have insurance until she married my stepdad. That's when she started going to therapy. So I guess my question is, what is your advice for people who just don't have that type of access or those resources?
It's a very good question. There are several resources in Austin that, well, first of all, there's several of us that do sliding scale fees if you don't have insurance. If you are working for any company, one of the things you want to ask if they have an EAP program, an employee assistance program, which you do not have to carry the insurance to qualify for like 3 to 6 sessions with that. And most companies carry that. There's organizations here that will provide therapy for next to nothing. I know like Capital Area Counseling is one of them. You can go there, they go based on your income, and you can pay from 0 to whatever you can afford. And that's a great resource, and I think there's a couple others. LifeWorks as well provides that service. So really, you can do a Google search on therapy for cheap, and things will come up. I mean, we have the resources out there. And even calling a therapist, seeing if they take a sliding scale fee. Some will go as low as $50 for a session, some even lower than that, I believe. So really calling them and just checking and seeing if they are willing to go with a sliding scale.
The other piece of that, if you are a student, a lot of universities offer free services. And a lot of universities, even if you aren't a student, because it's a training ground for a lot of other up-and-coming psychologists and therapists, you can access a lot of those services. I have a lot of clients that want to access psychological testing, and I refer them to universities because they can get a whole psychological assessment and evaluation and workup for much cheaper than they would otherwise. So looking at your universities, we have lots of universities here. If you are a student, if you're not, also checking with them to see, because again, there are a lot of times training sites for people to offer services.
I think NAMI also, NAMI, they have a database, I think, as well for different psychological services.
One more question.
We talked about identifying the problem, but what does success look like? Like, is there a point to where if you have the problem, do you stop going, or is it something that you do for life? Like, what does it look like, you know?
The first thing that we will talk about is what your values are, and what if you did not have the issues you came into therapy for, would that look like? Like, what would it look like? That's the first conversation we would have, so that we know what we're trying to get to. And personally, I don't want to keep you forever. Like, that, then I'm not doing my job. Like, I really am not doing my job if you're in here, if you're with me for too long. And so it really just depends. And I mean, I've seen people come to me for 6 sessions and they're good. Like, they're good. And some people may need longer. So it's individual.
We don't have time machines. We can't go back and make this traumatic event not have happened for you, but we can get you, with your help, get you to a point where it doesn't affect you on a daily basis as much as it did. And sometimes that's good enough. Sometimes that's the good enough. Sometimes we process deeper. It's very individualistic, and it just depends on how deep and how far we need to go.
I like to tell individuals, particularly parents that bring in kids and they have these behaviors, right? If the kid is 10, if the kid's 10 and this has been going on for 5 years since they were 5, coming to me 3 times is not gonna heal what's going on. So I want to normalize the fact that there are some situations where things can be very brief, but there's also some situations where people are in therapy for a little longer, and you just want to normalize that and understand that if something's been persisting for 20 years, 10 years, 5 years, you want to look and make sure that you don't feel too overwhelmed and saying, okay, this is taking so long. Sometimes it does take a while to get to where you need to be, but any good, like the people up here, good quality therapists, our goal is to get you out and functioning without us on your own.
And you also have to ask what type of therapist your therapist is, because there's some out there that, like the psychoanalyst, am I right about that?
Yeah.
Well, you might be there for years because that's just the type of therapy that they do. So you want to make sure, you want to have that conversation with your therapist about what this is going to look like.
And if I can make it more, at least like more tangible, typically when you go see your therapist, there's an initial conversation of, tell me about your whole life while you're here. Usually the second or third conversation is, what do you want to accomplish? And let's talk about how long that's gonna take. Because that way we're both on the same plane. Hey, this is gonna take, let's look at 15 sessions. After 15 sessions, these are the goals we wanna accomplish. Let's check in at 7, see where we're going. And then that way at 15, you already know, hey, we've accomplished these goals, and let's talk about if we need to do some more. But it's not supposed to be limbo where you just come in and kind of arbitrarily, go somewhere. There's a plan of action. I mean, it's like going to see your doctor. You're going to take this penicillin for, till it's gone, 16 weeks or 16 pills of penicillin, and then you're going to come back and check with me in 2 weeks, that kind of thing. So there's a plan of action that should be on paper, and that way you know where you're going, and then you can look back and know where you came and what you've accomplished, and then make new goals and should you go from there, or even stop treatment and say, I've accomplished my goals. I'd like to check in with you maybe in 6 months and see if I can go live my life with all these new techniques I've learned. Go live my life, and if I want to check in with you just to tell you what I've done, you can do it from there. So that's typically how it works.